to contend with. So the reason why we're here today is to speak about a situation that has arisen for us forever. We have a lot of members, as I mentioned today, that live in zones of conflict. Right now we got Venezuela, we got Yemen, for example, Syria. They are in terrible situations. And then on top of that, there are situations of natural disaster. And I am very aware of this for personal reasons. When I was 17, my region of Italy was struck by a very, very big earthquake. And this earthquake was stronger in rural areas. And at the time I was with the Scouts, so I signed up to volunteer and help. And I witnessed firsthand very elderly people in that region losing everything. So they had a little hovel, maybe, with a few goats, a few chicken. And then when that went, these people didn't know where to sleep or what to do. And for me, being so young, it was quite a shock to understand what happens when change of this level strikes us. And we all know that people don't like change. Change is something that is very difficult to embrace in our life. And forcible change, it's even more difficult. And in these years that I have been at ADI, the country that has been by far most hit by natural disaster is the country of Michael. Indonesia is a beautiful place, but as many beautiful places, beautiful for a reason, because there are a lot of volcanoes, there's beautiful sea, and the sea can turn against you. There can be floods, inundation, there be all kinds of problems. And most lately, we have had the case of Irina. And Irina has come to us from a country that was a very happy country, a very wealthy country, a very well-functioning country. You have heard today from the symposium in Taurex how their entire clinical trial was disrupted because all the people doing their data were in Ukraine. And so this beautiful, happy, progressive country all of a sudden wakes up one morning and is under aggression. And then what do you do? And in our case, we are dealing, as I said this morning, with the most vulnerable in society, people that cannot defend themselves, and also people that are particularly disrupted by the things that are happening around them. Many years ago, about 4 or 5 years ago, I had a discussion about doing a report on this. And after we had this discussion with another 2 external organizations, we came up with the report Forgotten in a Crisis. But the report Forgotten in a Crisis was a bit of it was a nice report, but it was a bit of a report that was based on policy. So it was advising government what to do in case there were crises in their areas. But famously, governments don't want to engage with that because, of course, it's only where the crisis struck, and then when it's struck, they say, oh, well, we've got better things to do, so we don't want to think about policy. So in the case of Irina, we realized, leafing through the report, there was nothing really that could help Irina when she asked us for help. And instead, and I don't know if somebody's advancing the slides, but there is a second slide to this. Echo, there we go. And when that happened, we had to change completely tack and go from a very complex report to something very practical that people could put in public places, advising the public in general about what to do if there was a person with dementia in their home during the war, the bombing, what is that they should do, what was the safest thing to do, what would be the thing that would confuse people less, how could family cope. And this session is born out of that. We wanted to share with those of you that are interested the experiences of Michael and Irina. So I'm going to stop talking now, and I'm going to ask Irina first to tell us about what actually happened in Ukraine of people living with dementia. And then I'm going to ask Michael what his experience has been. And then we'll open up to questions. Irina.
Thank you very much, Paola. I have, thank you. So first of all, thank you very much, Paola, ADI, for inviting me to speak today at the conference. So to start, I can say that till the very last day, nobody believed that this could really happen, at least at this scale. So people were not prepared. Nobody was prepared. So not speaking about people with dementia, but nobody was prepared. So when it started, when the war started, the pharmacies were closed, the shops were closed. People didn't have, the stocks of food, the medications at home. So what our organization started to do is our volunteers, which at that time we had 40 volunteers around the country. Now we have more than 70 volunteers. So we just physically started to search for medications in those few pharmacies that were open and transfer them to people with dementia, our beneficiaries. So each case individually. Then we contacted ADI, WHO. We tried to search for help to bring medications to Ukraine because we didn't know how the war will continue. Will we have at least any supplies of medications? So, and we were very lucky. We found partners, Americas, that brought a lot of medications to Ukraine, and now we are distributing it throughout the country with the help of the ministries. And before the war, we were, you know, with the ministries, we didn't have a very close contact. But now we are working very, very, you know, like a team with them, with both, with the Ministry of Health and with the Ministry of Social Affairs. So that is a positive effect that we can see now from what is happening. In general, I can say, and I wouldn't be afraid to tell it, all of the people with dementia, the relatives of all of our beneficiaries, they told that the state of people with dementia worsened a lot. Some of the people stopped recognizing their relatives for the first time. Some became aggressive. Some started, like really physical state worsened a lot. So all the symptoms, you know, all of them. And I'm speaking about those who stayed in Ukraine and those who fled from Ukraine, surely. So we can imagine the situation in the city, for example. So we hear what we hear, and what we are continuing hearing now. It's a constant, you know, air siren, very, very loud. So it's really a very difficult noise to bear. So it's sounds of the bombs and constant air, you know, siren. So we can imagine people with dementia hearing these new, strange sounds. And the relatives as well, surely, you know, have this effect. So it is a curfew, so you cannot go out. For example, a person with dementia used to go out and have a walk. Now it's closed, so complete social isolation. When there is a curfew, we have to go to the bomb shelter because, you know, it can go to your house. Those relatives who tried to do it, they told that this is the first and the last time they tried it. So you can imagine the, you know, not prepared bomb shelters. So the, you know, the bunkers, you know, dark, or, you know, like a lot of people inside. You can imagine a person with dementia there. So it's very, very stressful. They don't do it. Even when there is a recommendation to be, for example, in a bathroom or to be between the walls, you know, in the flat, it is difficult to explain the person why we have to be there at this time when there is a siren. So for us, in general, for people with dementia, it is an extremely difficult period. And we try to help our families as much as possible. As everybody is now stuck at home, we launched online support. So we have online consultation with psychiatrists because because as I told, the state worsened a lot. Then we have psychological support. So before that we have support groups of relatives, and now we do individual consultations with relatives. And now we are also launching and we launched already the consultations with people with dementia as well. This is new for us, and we would like, if anybody has experience how to work with people with dementia in psychological sphere, we will be very happy to learn, because we don't have in Ukraine much experience with that. We also do online consultation with care, how to care with people, to provide care. Another thing what is happening is that some territories were seized. So we can imagine the gerontology nursing home or a psychoneurological institution which doesn't have electricity, water, heat, and it started in winter in February, so it was very cold. unfortunately, people were, in these conditions for a long time. A lot of people died. A lot of people died of hunger, including. So people were stuck at homes. So I tell you like it is, unfortunately. So in some cases, we receive calls from the relatives asking for help. But if there is, it physically could not access some territories. So then we found a partner. But individually we tried with evacuation. So those people who were on a more or less safe territory, there is no safe territory on Ukraine now. But we individually helped to evacuate on the west of the country or further to Europe. And then we found a partner, Médecins Sans Frontières, the Doctors Without Borders, and we are now organizing a more systematic evacuation from the dangerous regions to the more safer regions. It is still happening. So another thing, for example, that we are bringing the diesel generators, because when the territory is now free, it is completely ruined, there is no electricity, so we try to help in new ways that we didn't do before the war. So a lot of our work now is really like, spontaneous. We just try to respond to the crisis that is happening. So I just want to thank you all the countries that support Ukraine. Thank you so much. That without you, there would be no chances. So I just want to ask you, please continue supporting Ukraine. Please do not take the war for granted. Please support people, our refugees with dementia who fled to your countries. They are in extremely difficult situation. We try to also help them. At least you can give us the contacts of, give them the contacts of Nezabutni, and we will coordinate a little bit. So thank you very much, and thank you ADI, and I hope that together we can, overcome the two challenges, the war in the Europe in the 21st century and dementia. Thank you very much.
Grazie Irina for the amazing work that you are doing. It's been serendipitous that we got to know that you were doing this at the right time. Again, it's sometimes amazing, isn't it? Because you don't know that there is a network. So, Michael, Alz has been in the networking side for many years. Your experience?
Yeah, thank you, Paola, and thank you, ADA, for the opportunity. I have a slide. Yeah, this is the coping during a crisis from Indonesia. So I want to brief shortly about the Indonesia that we have a 17,000 islands that we have a lot of the sea. And then next slide, please. And then we have the volcanoes, a lot of mountains, and then we have a climate, like only two climate in Indonesia, rain and dry. So the climate makes the Indonesia to prone the flooding, and then the extreme weather like now is very changing the climate. And then the when the COVID-19 pandemic era in Indonesia, there's more than 6 million cases and 157,000 death cases. That 56% is elderly. So this is our action with the natural disaster, also the pandemic era. Next slide, please. That there are more than 2,000 natural disaster. So this is from the National Agency for Disaster Countermeasure from our government, that they have already evacuation plan, the weather forecasting, monitor, and indicator for early warning, that all of they do is for all the people. But like Paula said about the crisis, the people living with dementia and also the elderly sometimes not too as a priority for them. Okay, thank you. But so this is what Alzi do. So we trying to giving from our chapters to give the staple packages, because a lot of the elderly and a lot of people with dementia hungry with no food because the impact of the flooding, extreme weather, and when I go to the place, the houses is all is flooding with the water until the top of their home. So we trying to give what they need, like the funding. So we can buy them the blanket, the clothes, and the other for their activity living, and then we're reaching out for all the adult communities to helping, because a lot of elderly with the shelter is not cover maximum with the government. So we as a civil society trying to find to collaboration with private sectors to help the elderly and people living with dementia. But during the pandemic era, Alzheimer Indonesia created the Narazi, or we call it Alzheimer Navigator. This is to support teleconsultation like you do for the elderly and for the family. So we created the online communication to support the people living with dementia, because when the pandemic era in Indonesia, no hospital can accept that the elderly to go outside. So we're trying to make this happen in the April 2020, so the people living with dementia can be safe with the navigator. We have a doctor, specialist, neurologist, psychiatrist, also the geriatrician or psychologist and physiotherapist to help the people living with dementia and the caregiver to navigate the journey of caring. So this is what we do. The caregivers meeting, we do it consistently with our chapters also. So we try our best to make the safe for the caregivers and people living with dementia. And the last slide from Alzheimer Indonesia is uh, okay, yeah. So the first thing we do, we identify the community and internal team, because it is important to us which area and which the older people that we need to help, and then we contact the person and analyze their needs, and also we involving youth generation. Why this is important to involve the youth generation? Because they are our strength, our volunteer, that they will become the elderly in the soon. So they try to their best for now for experience. So if they become an elderly, so they know how to support the elderly since in the beginning. So continuing support for older people and people with dementia is our priority community, because they are our primary, and this is our aim from Alzheimer's Indonesia to improve the quality of life of elderly people with dementia and their caregivers in Indonesia. Thank you so much, Paula and ADI. Thank you so much.
Thank you, Michael. And wasn't the teddy adorable in that? You always have the most cute graphics. Now, I have been speaking with the team to see if they allow me to go a little bit over time. There's another session that somebody's taking the chair of, so we can have a few questions. So really, both Irina and Michael have spoken from the heart and told you what they've been trying to do. Believe you me, they have articulated this very cogently, but at the moment of need, there was a bit of a different type of articulation when things were looking quite dicey. So can I ask any of you whether there are any questions? I don't think there are any questions online. Anybody got any particular question they would like to ask? No little hands up? A hand up, yes, please.
I just want to ask Irina about Ukraine in terms of the assessment. Thank you. Pre-war, was there any sort of, what was the process in terms of diagnosing and assessment and treatment for dementia?
Thank you for the question. We in Ukraine are on the early stage of, settling all the processes about dementia, about diagnosis in particular. Ukraine is a country where dementia is not diagnosed, I would say. Official data is 62,000 people, but according to the Lancet Institute, it is 651,000 people. According to the Institute of Gerontology in Ukraine, it is minimum 800,000 people. Unfortunately, people do not know what is dementia in Ukraine. And it is, we can say that from different sides, people are afraid to go to ask for diagnosis, for example, because it is a big stigma that even those who know, so it's better not to go and to hear the diagnosis. At the same time, the doctors as well, it is only the psychiatrists who can put the diagnosis. And people are very much afraid to go to this doctor. So the general doctor, he cannot do this diagnosis, and the neurologist also cannot. So we are now in the only initial stage to find out, to realize how to change the situation. So we do not have a national dementia plan. So we are now very happy to be here. I'm very happy to be here today, because I can see that this is all possible. When I see all your, amazing work, that for now we will start, working on a systematic level. But for now it is like this. But it's really getting better, because now we are really in good relations with both ministries. So I hope that we can use some, good scene from what is happening to build. Yeah. Thank you.
Thank you very much. Any other question, or is there anyone that would like to share their experience of being in a crisis? Yes, Tomas.
Hi, my name is Tamás. I'm originally from Hungary, and a couple of hundreds of thousands refugees went to Hungary or crossed Hungary. Have you reached out to the Hungarian association which is supporting people with dementia?
This is a question to me.
Yes, sorry, Irina, it's a question to you.
Yes, thank you. So we organized several calls with ADI, where we invited member states, and we told, so ADI told that there is Ukrainian Association of Alzheimer, which is a charitable foundation, Nezabutni, so we can provide support from our side, at least for what I told, online support. The biggest problem is that what we see now, that the refugees, they come to the host families with a person with dementia. And then the person with dementia can be, with different syndromes. And then, for example, the case is that you can stay for some time, but then then the family sees what is happening, they ask them to leave, because they just cannot handle it. Or, for example, when there is, even when it's your relatives coming and you live, all together with a person with dementia, it is very difficult. So we ask the local dementia organizations to reach out to the nursing homes and ask for, if it is possible, for free stay, at least for some months, for people with dementia. That would be a huge support. So I'm not sure if we are in a direct contact with them, but the countries were informed that we, from our side, try to help. And I really encourage, please, if you have time, reach to the refugee centers or some centralized refugee institution in your country and say that if somebody with dementia comes to you, please forward them to us, and you can then forward them to me, and we can together, each case, work on.
Okay, I believe the Hungarian association, which is called Social Cluster, is not a member of ADI yet. But I can help you to get in touch with them, because they are closely associated with the biggest Catholic charity in Hungary, and they run care homes.
Thank you very much.
I'll talk to you after the session, okay?
And that would be very lovely, Tomas. It has to be said, Irina, we not always the ADI network has been able to help, because of course we don't necessarily have what Irina needs. For example, in the case of medication, we introduced Irina to WHO, and then the work with Médecins Sans Frontières started there. There are so many charities that are way better placed than us to deal with the kind of provision or supply chain. And this is the importance of this meeting, because each one of you may have some idea here, and that may help Irina get a better deal for the people that she's trying to help. So thank you so much. Anybody else would like to say anything? Yes, please.
Hi, thank you both for your really important presentations. I had a question for Irina about care homes, nursing homes in Ukraine, and I just wondered whether you could share anything about the situation for residents in those facilities and what's happened since the war started, and whether there's been any ability to try and move people from facilities to help people flee, and if not, kind of what's the possibility for trying to care for people in those facilities at the moment? Thanks.
Thank you. So in general, so we have public institutions, nursing homes, and we have some private institutions. After the worst, the level, I would say, because I now fled also with my daughter, I fled to Geneva. So I spent this 3 months in Geneva visiting nursing homes, daycare centers, and I can compare. So we have really a long, work to do in Ukraine in this direction as well. But when the war started, so surely some of the territories were completely, under shelling. So all the people were evacuated to the west of the country, and very, very soon they were overcrowded, these places. So the current situation is that it is all packed completely. And for example, with MSF, what we are trying to do is in one particular, for example, institution, we are doing a renovation of the 5th floor to give additional 45 beds. So it is like, picking, finding places in each institution to find shelter for people. We analyzed all the private nursing homes. And we now have a mapping, and we on our website, so we launched a special website which is called Nezabutni United, which is directly made for during the war, where people can receive war support during war. And on this website we have a map of all the nursing homes and with free places, that have free places. And we update it every 2 weeks, where are the places. If you have in your countries any institution that is willing to accept people for free, because it is the level of, the salaries, it's very, very different in Ukraine and in Europe. So for us, it's extremely difficult to pay this amount. Plus, people lost sometimes everything, the whole building, nothing. They don't have anything at all. So they just cannot provide this. And for example, another problem for refugees is that they, for example, there is a mother with dementia, for example, and her daughter, for example, 40 or 50 years old. She wants to find a job to pay for this institution, but she is with the mom. She has to take care constantly of the mom. So it's like a circle, So for us, it's maybe just to ask, just for these several months. We hope, nobody knows, but maybe realistically, it's till the end of the year for sure. I mean, nobody knows. This is like my guess, but till the end of the year for sure, maybe at least for this time. And all of them want to come back home. All of them, especially, elderly people, a lot of them didn't want to leave. They stayed even under occupation, because this is their home. I will die here. I will, and even like physically, we try to, it's dangerous, but for them it's their home. So they will come back. But just if you find places, and I know that on the level of the ministry, for example, in Spain, I know for sure there was evacuation of 90 people to some facilities. So the government is working as well on this direction. But if you, on your level, know some institutions that are eager to, it's like most probably private institutions that can accept 5 people, any 2 people, I will immediately give this information. Who will? So there will be people who will be very happy to come for this time.
Thank you so much, Irina. Now, we haven't got more time for questions, even with our extra time, but I wanted to ask one extra question to Michael. And it's about the fact that you in your country had the most horrendous tsunamis in man's memory, and that was over a decade ago. So do you think that after that experience you would feel that your government were more prepared now to deal with the emergency of vulnerable elderly people than it were 15 years ago? How do you think? Is that improved?
Yeah. Okay. Yeah. From that moment, it's very difficult for Indonesia, because the tsunami not only for the North Sumatra, Aceh, but 2 provinces impact of that. But after the situation, our government make an improvement about the evacuation. They already have they already have the evacuation plan and correctly about the sign of the tsunami, because our island and our area is a lot of the tectonic. So it became a tsunami or volcanic, and there another disaster will become. So our government after that making the progress with their work, but our community like in Aceh and then Medan, they already have a signal. If there anything about the national disaster become like tsunami or volcanic, our community will be prepared to support, like the team, to make something happen. They will prepare about the food or something. So when the shelter is ready and then the tsunami or come, I hope so now. For now, yeah, I hope so now. But the shelter, but the our government will be prepared on that. So I think 15 years is learned from Indonesia to to more be prepared or better. Thank you, Paula.
Thank you very much, Michael. So we do learn, and of course, that is the whole point of the conference. We learn from each other, and preparedness is important. And I know a lot of governments don't want to be prepared, but my government learned to its own cost that you need to be prepared. And after some horrendous earthquakes in Italy over years, now finally we have a proper response unit that knows what to do when something like this happens, and how to make sure that people have homes, first and foremost, food and shelter. But it's taken even a country which is quite wealthy, possibly about 120 years of absolute disasters to come to that conclusion. So with that, we conclude this session. I thank you very much for coming. Now, if you have any idea, this is a practical session. The ADI workshops are practical. So after this session, if you have any ideas, or if you think that you have any ways for us to improve on what we have, do please get in touch with Laura Dabas, our membership manager, because we can always translate this practical advice into practice, and who knows, one day somebody's life may be saved or at least made better by the advice that we share in this session. Thank you so much, and again, apologies for being late.